Good morning, everyone. Good morning, good morning, good morning. Thanks for your patience as we get ready to embark on our 2025 NJIIS Immunization Conference. It's so nice to see so many familiar faces here, so welcome. I will give a quick welcome to those who are joining us via Zoom. This is our first time doing that this year, so welcome to you all as well. My name is Colleen McKay-Wharton, and I work at Rutgers School of Public Health at the Center for Public Health Workforce Development. And we are delighted to be co-sponsoring this event with our partners and colleagues at the New Jersey Department of Health. I'd like to give a shout out and a thank you to Kendra Julian, who's way in the back, for leading the planning committee. Thank you, yes. Thank you. As you know, these things are no easy task to pull off, and there are always glitches, and today is no different, so you know that always happens. But Kendra did a great job, along with our colleagues at DOH, for planning this event. So welcome to all of you. Today's title of the program is called The Power of Prevention. I should wear my glasses. That would be much more helpful. New Jersey's Path to a Healthier Tomorrow. My task for this morning is just to do a little bit of quick housekeeping, and then we're going to dive right into the program. So first off, I just want to be sure to thank our exhibitors, who I think you've all had the opportunity to visit out there. They really are critical to supporting this event each year, and they also share a wealth of information. So I hope you all visited the tables, and here is just the reminder that in your program brochure in your bag, you'll see that passport, right? So you should visit each table and don't just ask for the stamp, okay? Please talk to them, learn about what they do, right? Ask some questions and get the stamp, and then when you're complete, you can tear it out of your brochure and drop it into the box up front where the credit signatures are, and we'll have an amazing prize at the end of the day. And it's not a car. Let me tell you, it's not a car. I'm just going to say that much. But thank you to our exhibitors again for making this happen. Just in terms of some housekeeping, I already covered our exhibitors. Please be sure to chat with them and learn what they offer. If you haven't turned down your cell phones already, please do put those on vibrate. We know everyone has important calls to get, but try to be respectful. Today's program will offer 5 continuing ed credits: public health, nursing, and health education. Just a reminder, there was a separate table for the nursing credits and the health education credits. So that was kind of when you entered the room. But when you signed in, you'll automatically be submitted to NJLMN for public health credits. So if you have an account in NJLMN, you will receive credits for participation. We do ask, if you can, and if you haven't already, hop into NJLMN later today, tomorrow, and just register for today's event. We know you all registered through our online registration system, but it's helpful if you get your name in there to NJLMN as well. We will, as always, have an evaluation at the end of the program. Don't do it till the end of the program. You will see this on the back of your program brochure. There's a QR code that we'll direct you to again later today, and you need to do that also in order to receive your credit. So we'll point that out again a little bit later. And just a word about what's in your bags. Obviously, you have the program brochure. You have also the immunization schedules. You have both the children and adolescent schedule and the adult schedule in there. Just note that these change every year. Right, so you have the 2025 version, and I made this mistake years ago and sort of went back to one that I've had sitting on the desk. They change every year, and you're going to hear about those important updates later today as well. But just know that this one is only for 2025, and the website is there. Also, the slides for today will all be available on our website as well after the program. We very much appreciate that our partners, I'm going to pull this a little closer, at the New Jersey Hospital Association help us with our nursing credits every year. We're very grateful for that they do this for each program. You have all seen this announcement before. I won't read through all of it, but you know that this activity awards a maximum of 5 contact hours for nurses. So, keeping up with social media. If you are likely to post, and I know some of you are very active posters, which I love seeing all of what you share in your normal careers, please do tag us for today's event. It's hashtag NJIC 2020, just 25, and you see the others up here as well for DOH and the School of Public Health. If any of you attended our symposium back in April, you may remember that we have a really great photo booth that starts to happen at the breaks. So you'll have an opportunity to, hold up some props, get your pictures, and we encourage you to share those things throughout the day. I will again point out that you should have your program brochure. In addition to the exhibitors that are there, you will see the full schedule of today's events. We'll be walking you through it as we go on through the day. Just note that there are a total of 4 breakout sessions, and you get to pick 2, right? And you can switch. We'll have, there's an hour for each session. Some of you already selected your programs, which sessions you wanted to attend to. And if you're not sure, we have the list up front, so you can go check that out. At the end of the day, it's okay if you change your mind. That's really okay, too. We just wanted to get a sense of space. What else? Okay, I think that covers my housekeeping for the morning. I am delighted to invite up today Dr. Barbara Montana. Barbara is the medical director with the Communicable Disease Service at the New Jersey Department of Health, and she oversees the Vaccine Preventable Disease Program. Barbara is no stranger to all of you, I know. She received her medical degree from NYU School of Medicine and completed her residency in internal medicine at Pennsylvania Hospital in Philadelphia, and also did a fellowship in infectious disease at Bellevue and at NYU in New York City. She is board certified in internal medicine and infectious diseases. Got her MPH from where? UMDNJ, / Rutgers, formerly UMDNJ. Wonderful to have our alma maters here. And Dr. Montana is also an adjunct professor with us at Rutgers School of Public Health in the Division of Epidemiology, and still sees patients in Long Branch at a clinic, which I love. So, are you good to go?
I'm good to go.
All right, let me minimize. Thank you. You just got, yeah, sure, no problem. Yep, next. Something, did I not go to slide? Oh, you're good. You're good? Okay, thank you.
Good morning, everybody. It's good to see a lot of familiar faces and new faces as well. I'm going to talk a little bit about our program. I don't know how many of you have interfaced with parts of the Vaccine Preventable Disease Program. You tend to focus on the groups that you work with the most, and I don't know how many people know the breadth of the program that exists at the department. So one of the bigger component areas in the Vaccine Preventable Disease Program is the Vaccine for Children program. This is the program that allows folks to vaccinate children who otherwise may not be able to get vaccinated because of an inability to pay. We work with lots of providers through that program. We provide vaccines to provider locations, and then they are the folks, the really important folks, who actually get the needles in the arms to get the children vaccinated. So although we administer the program and its success is really dependent on the providers who actually are interfacing with the children and providing those vaccinations to increase our immunization rates. Similar to the VFC program, we have the 317 adult program. This program allows uninsured and underinsured adults to be vaccinated in various locations, usually FQHCs or local health departments. Unfortunately, this program is underfunded. It is primarily funded through the federal government, and with all of the cuts, we have struggled with maintaining an adequate inventory. We do have a small supply of state-funded vaccines that we do make available to mostly our FQHC partners and some local health departments, but that also is very limited. So unfortunately, we don't have a huge supply of vaccines for our vulnerable adult populations. Next is another huge important area is our New Jersey Immunization Information System, NJIIS. That is the repository of all of the vaccination information for people who are vaccinated in New Jersey. It is set up by statute, and we have regulations that govern it. In addition to being that repository, a lot of people work with NJIIS not just for the recording of vaccinations, but also for the management of the federally funded vaccine programs such as VFC and 317. So providers use it to manage all of their inventory and make sure that the doses are accounted for by keeping a very detailed inventory within NJIIS. The other big group is surveillance. Not very many people, I don't think, interface with surveillance on a regular basis. They are responsible for keeping track of all our reportable vaccine-preventable communicable diseases. So when there's a reportable disease like measles, which everybody has heard about recently, that is the group that works with the providers who make the report to make sure that all public health protective measures are put into place, that the cases are isolated, that people who are contacted are quarantined, and they work to keep all of the statistics for how many cases we have in New Jersey at any time. They work very closely with the local health departments, who are the primary folks who receive those reports and really serve as the subject matter experts for the local health departments as well as for the providers who are interfacing with the folks who have contracted those vaccine-preventable diseases. Next is our data team, which is a relatively new team to the VPD program. Those, our folks in the data team work with all of the different component areas to try to meet their data needs. So for instance, they work with surveillance to better keep track of the number of cases. A big group that the data team works with is population assessment, because they help to keep track of all of the school statistics for meeting immunization requirements, the religious exemptions and such. And the data team has really been working very hard to develop interfaces or dashboards so that the public can view that data and manipulate that data more easily. Right now, a lot of the data is in PDFs and in forms that are more difficult to manipulate. So hopefully, with the data team, you'll see changes to your ability to access the data that the department has available. Another big area is population assessment. That's been around for quite a long time, and I'm sure lots of you have interfaced with Jenny Sudhakaran, who has headed that area for a long period of time. She is responsible for identifying pockets where immunization rates may be a bit low. She is responsible for gathering all of that information for the school assessments to provide summaries of how many children are meeting all of our immunization requirements, our religious exemptions, and such. And that data is all available through our website. And again, we're working to make that more user-friendly by using the data team to have dashboards and such. And finally, health education, which is the heart of really any program that interfaces with the public and providers. They take all of the information that we have, all of the technical jargon, and really put it in a form that's digestible for the general public. They help to come up with all of the outreach programs that we have in effect currently, like our Protect Me with 3 and our Hot Shots for Tots. So really, they're the heart of the program in interfacing with all of our stakeholders. So that is a quick summary of who we are, and hopefully you'll get to meet a lot of us today, that we have representatives from all of the different component areas here, and feel free to reach out and speak with them. Throughout the day, you're going to hear from leading experts who will review the data on the benefits of vaccination. I know that there's been a lot in the news recently, and we really want to emphasize the benefits of vaccination. We're going to hear from folks who are sharing their stories on how vaccine-preventable diseases have impacted their lives. We're going to explore strategies to overcome barriers to vaccine coverage. I really do encourage you to network today, because we really need to collaborate to make sure that our message is out there and that our message is credible. So with that, I'm very pleased to introduce our next speaker, Jeffrey Brown, who is currently acting as the Commissioner for the Department of Health. Commissioner Brown recently served as the Deputy Commissioner of Health Systems at the New Jersey Department of Health, overseeing inspections and the enforcement of regulations for approximately 2,200 licensed New Jersey healthcare facilities, over 2,700 mental health and addiction services and programs. The Certificate of Need, the Office of Healthcare Affordability and Transparency, and major hospital funding programs such as Charity Care, Graduate Medical Education, and the Quality Improvement Performance Program. Prior to his role as Deputy Commissioner of Health Systems, Commissioner Brown served as the first Executive Director of the New Jersey Cannabis Regulatory Commission, where he was responsible for organizational strategy, policy, and management of a new state commission, and as Assistant Commissioner for Medical Marijuana under the DOH, his work included expanding access to the medical marijuana program from 17,000 patients to more than 125,000, leading and overseeing the first ever comprehensive regulations to underpin New Jersey's personal use cannabis industry, development of one of the most innovative laws and tax structures for cannabis sales in the country, and managing the regulatory oversight of a new billion-dollar industry. During the COVID-19 pandemic, Commissioner Brown served as the Department of Health's lead in establishing the Atlantic City Field Medical Site and was a member of DOH's COVID-19 testing task force. Before his time at DOH and the CRC, Commissioner Brown worked extensively on the passage and implementation of the Affordable Care Act, particularly the creation of health insurance exchanges and the expansion of Medicaid, has led an association of community-based providers to implement innovative new payment models in Medicaid, and has fought to expand access to health care in New Jersey's urban communities by developing sustainable financing policies. Commissioner Brown grew up in Mercer County and graduated summa cum laude from Rutgers University. Yay! And with that, Commissioner Brown.
Sorry, folks. I seem to have lost my cursor. Chai, I think we've lost the cursor. Are you seeing it here? Yeah, it's not leaving. Okay. It won't X out, Chai? I can't leave the current slide. Nope. Thank you. I need to just minimize this and open up number 3. There we go. Thank you. Number 3. Thank you so much. Perfect. We're good.
All right, very good. Thank you.
So much. Thanks for the affordable care. That makes you the star.
Yeah. Good morning, everyone. Thank you for having me. It's an immense privilege to be here. First and foremost, when I've only been in this role for a little over a month, and so there were a lot of events that we were working to transfer over when Dr. Baston left to go lead University Hospital, and initially this was tough with the calendar, but given everything that's happening with vaccines and the importance of the topic today, really wanted to be here, and so I'm really happy that we could make this work and that I could be here to talk with you all. Want to acknowledge Dr. Montana, the VPDP team, everybody at the Department of Health who's helping to make this conference happen, everyone at the Rutgers School of Public Health. Also want to acknowledge new Deputy Commissioner, Dr. Navneet Sahu. He's the new Deputy Commissioner for Public Health Services at the department, formerly Medical Director for our Office of Emergency Medical Services. Also want to acknowledge former Commissioner Mary O'Dowd, who I know will be speaking later. Really great to see you. I know when I was cutting my teeth earlier in my career, I think Mary was commissioner, and I think I was at the Quality Institute at the time, and we worked on a number of very important initiatives together. So great to see you again. Before I get into the slides, just a bit about my background. As noted, I've worked on health reform and health policy for years now, and what got me into that is not because I'm a physician, not because I came up through public health initially, but I really came in as a consumer. And before the Affordable Care Act, before some of the health reforms that we enacted in this country, I lived firsthand what it was like to be in a fragmented healthcare system where not everything was reimbursed by health insurance, where there were coverage gaps. And because of that experience I had, because of the experience that family members had, I really wanted to get into public service. First, fighting for elected officials who wanted to reform healthcare, but then, more importantly, moving over to really working with nonprofits in more of a nonpartisan nature and working on solutions that really improve healthcare at the nexus of really 3 places: access, quality, and affordability. Because when we're talking about access, when we're talking about healthcare, all 3 of those facets are really important for people, for patients, for individuals accessing the healthcare system. And there's not a single thing that I can think of that is more affordable, yields higher quality outcomes, and is more accessible than vaccines. And so I'm thrilled that we're here to talk about this today. The other thing worth noting at the outset, I grew up in a family. My dad was a scientist. He was an environmental scientist. He did bioremediation was his specialty. But from a very young age, I was taught that we approach life and we approach problems with scientific rigor, and we look at data, we look at evidence, and we make evidence-informed decisions. And that's why at the department, one of the things that I've been stressing is really having and we do this naturally, but really focusing on a data-driven and people-focused approach to the work that we do. I'm just going to cover some rudimentary things, I think, compared to what you're going to get into as far as the details later today. But I do think where we are in history, where we are in this moment in the country, it's really important to just note how important vaccines are and how effective they are. Let's see. Hold on. Is this the? Let's see. Ready. There we go. Okay. There we go. When I first came back to the department as deputy health commissioner, my predecessor, Robin Ford, who went up to work at NJII, she left on my desk the original Board of Health report from like 1877. It was the board, before there was a Department of Health, we had the State Board of Health, and the Board of Health issued an initial report. In that, one of the things that they said, and they quoted, it was a quote, and I'll paraphrase it, but it basically said, the key to a free and fair society is the health of the population. Essentially saying that we derive our ability to participate in society, to really be effective people and be a part of our society through access to health and the ability to lead healthy lives. Before vaccines, that was not as easy as it is now. As you all know, before we had a polio vaccine, you had people who had polio who had to be essentially treated in iron lungs, which you see here. Before we had vaccines, quarantine, people with infectious diseases were quarantined, and you had these notices placed on houses warning people to not enter those houses for fear of, some legal retribution. This is how the world was before we had wide access to vaccines. Boom. All right, back. There we go. And when we look at the benefits of vaccination, when we look at the evidence, the science, the data, it is crystal clear. Vaccinations work. They prevent disease. They keep people healthy, and they represent a tremendous benefit to our health system. And so this is just a list of, various vaccines that have been developed over the last, several hundred years. And you can see there not only the 20th century annual morbidity for those different conditions, but the reported cases in 2023, and then the percent decrease that you see. And it's really, from 97% to 100% decrease because of access to vaccines. And going back to something that Dr. Montana said, I mean, the vaccine preventable disease program at the Department of Health, a lot of the funding that goes out, whether it's the VFC program or some of the other components, it really represents the acknowledgement that vaccines are a public good. They are a tool that we have in public health to really drive down disease prevalence, keep people healthy, keep people from getting tremendously sick like they used to before we had access to a wide range of vaccines. And because of that, where people don't have health insurance that pay for them, we have programs to help them get access anyway, because it is a public good. So, this is particularly acute when we talk about children. When we're talking about the childhood vaccine impact, childhood vaccines represent, there are hundreds of millions of parents who didn't have to worry who don't have to worry if their child would recover from mumps or have lifelong paralysis from polio. And that's hundreds of millions of kids who weren't sent to the hospital. It's more than 1 million people who lived to become doctors, teachers, parents, and artists instead of dying as children because they didn't have access to vaccines. And that's just kids in the US born between 1994 and 2023. These stats are from a study of the Vaccines for Children program, which launched in 1994, and you'll hear more about today. In 2023, more than half of all U.S. kids were eligible for a VFC vaccine. And, I'll say in this room, just show of hands, just show impact. Raise your hands if your work is impacted, personally, professionally by the VFC program. See, boom, look at that. Amazing. And we see success with not only childhood, but adult vaccinations too. In both cases, the impact is reducing disease burden. And I know you all know the immense value of vaccination, and I'm preaching to the choir here, but again, given where we are in our particular moment in history, in this particular moment in the country, which I'll come back to, it really is important to celebrate the success we have and acknowledge the data that underpins that success. When we're talking about adults, the shingles vaccine is more than 90% effective at preventing the most common disease complications in shingles. And if shingles vaccine coverage reaches 65%, an estimated 4.6 million shingles cases will be prevented by 2032. and that means 1.3 million fewer physician visits and over 14,000 fewer hospitalizations, which is really an incredible impact. Again, vaccines are an amazing tool to really reduce disease burden, keep people healthy, reduce overall costs to our health system, and therefore improve public health. So, we all know that vaccines are essential, and I want to stop here and just talk about the moment that we're in, because, yesterday, particularly, where there was the latest news in what's been a series of unfortunate events at the federal level that we're all going to have to deal with. I mentioned that I wanted to prioritize coming to this conference, and it's because it wouldn't feel so urgent if we still lived in a world where everybody agreed that to follow the evidence, to follow the science, and really let that be the our guideposts above all else. But that's not the world we live in. And so because of that, we're navigating a level of uncertainty. And that's true at the department. It's true for all of you, whether you work in local public health, whether you work for healthcare providers, whether you're a student or a teacher here at Rutgers. We have a level of uncertainty that, frankly, I don't think has been seen in my lifetime when it comes to public health. So, I'm sure everybody in this room was as shocked as we were to see the Advisory Committee on Immunization Practices is essentially disbanded yesterday by the Secretary of Health and Human Services. This is a panel of independent experts. They've helped guide vaccine policy for decades. It's been, traditionally a non-politicized committee that, studies evidence, make recommendations, and generally how this works, in the past is you have the ACIP meets. They consider the data. They meet publicly, right? It's all in front of stakeholders who want to see what's happening. They then make recommendations to the CDC director. The CDC director then chooses to either accept those recommendations, modify, et cetera. More often than not in our history, those recommendations are accepted, and then they're ultimately published in the immunization schedule. So what's happened over the last several weeks and month is, first you had the Secretary of Health and Human Services announcing via social media video that COVID vaccines would no longer be recommended for healthy children and healthy pregnancies without input from ACIP. ACIP was scheduled to meet later this month. Apparently they still are, so we'll see what happens there. And then even in advance of the ACIP meeting, publishing the update, the CDC publishing the update to the immunization schedule even before that meeting could take place. And then, yesterday we obviously saw the news that the members of that committee had been essentially let go. Presumably we'll see new members appointed, but, we're really in uncharted waters here. Additionally, we've seen cuts to federal funding to develop vaccines. Yeah, I think there was federal funding cut related to development of new mRNA vaccines. And, I can say the science is clear when it comes to mRNA. There's not concerns, they represent incredible promise and value, whether we're looking at the effectiveness of the COVID vaccine or promise when it comes to other diseases, that's an important investment we can make that's no longer being made. So, how is this all going to play out? We don't know. I think we're looking at this closely. We're going to, really rely on our partnerships and collaborations to help get through this. That's really going to require everyone in this room. And I can promise this, as this develops, we're going to do everything we can at the state level, whether it's just at the Department of Health or working with Human Services, Department of Banking and Insurance, Governor's Office, to make sure that people in New Jersey have access to vaccines. That is going to be a priority here. I can say that emphatically to this group, and it's something regardless of what's happening at the federal level, we will use every power that we have to make sure that New Jerseyans continue to have access to life-saving vaccines. And so, I do want to acknowledge even beyond the events of yesterday and really what's been happening since January, that everyone in this room who is working in this field has been facing a crisis of public confidence for the last several years. And I want to acknowledge how hard that is for you all to deal with as providers, as public health professionals, and really thank you for still showing up and putting the work in and really trying to keep vaccine uptake as high as possible. Keep access to vaccines for every population in New Jersey, particularly the most vulnerable populations, and also, keeping us grounded in science and evidence. Again, that really needs to be at the core of everything that we do. Obviously we're tracking what's going on with measles around the country. There was news we've had a couple cases of travel-related measles here in New Jersey. The most recent one at a Shakira concert, which made, that made news. Thankfully in New Jersey, we haven't had to deal with the outbreaks we've seen elsewhere in the country. Former Commissioner Baston shared at our budget hearings that we've actually unfortunately dipped just below that 95% threshold in New Jersey, but we're hopeful we can push and get that number above 95% again in the future. There is one data point from a Pew survey that indicates some hope, and that's that when they surveyed adults, the vast majority of adults do report at least some confidence in their own healthcare provider to honestly explain the health benefits and risks of childhood vaccines and adult vaccines. So, people do still listen to their healthcare providers. We hope they will continue to listen to folks like are in this room, the experts. But really, when we talk about plotting the path forward, it's really going to be about collaboration. Dr. Montana mentioned in COVID, that was unprecedented for everybody. But I think a lot of us at the department, and this is true of healthcare providers, public health professionals, a lot of people had to step up and do, double, triple duty when it came to protecting the public from COVID and putting into effect mitigation efforts. I'm a big fan of Stoic teachings, and one of the things that one Stoic saying is that in the face of obstacles, the obstacles become the way. I think in COVID, I was really privileged to be at the Department of Health and see a lot of people, a lot of really committed public service presented with a once-in-a-lifetime obstacle, and really step up and address it in ways that that involve collaboration, partnership, following data, following evidence, and really staying committed to public health and public safety. So I think we're facing another inflection point like that. It's not a pandemic, but it is a challenge, whether we're talking about federal policy or the confidence that the general public has in advice and data. It's a challenge, and it's going to require everybody working together. And again, my commitment as acting commissioner of the Department of Health is that we will do everything we can to help you do the jobs that you need to do, and to make sure that New Jersey has access to life-saving vaccines. Thank you very much.
Come on up, folks. This is what happens when you give a Mac user a PC. You know how this is. I'm trying to get through some of my slides here. Why am I not? This was the one I'd like for the moment, and then I'll need another one after. Yep, and thank you. You can close hers. Thank you. Yeah, because I'm going to introduce the next speakers. I'm glad it's not just me having a problem. That's so, go ahead. I'd like, nope, right there. Thank you. That's the one. Awesome. Thank you. If I can invite our keynote speakers to come on up and have a seat while we get started. So thank you so much. Did he leave already? Did the acting commissioner leave? Oh, sorry. All right. That was outstanding, and thank you so much. That was a really valuable overview. Thank you. We are delighted to move on to our keynote presentation, to our keynote presenters. So I didn't mention earlier that we will be using sort of some shortened bio introductions here today, but on the inside of your program brochure, you can scan to see the outstanding work that all of our presenters have done, a fuller picture of their background. So this will be a little bit briefer than usual. So thank you to our keynote presenters. We're delighted to have you up tonight. Our topic for this session is HPV and cancer prevention. Our first presenter will be Mary O'Dowd, who many of you obviously already know as in her former role as Commissioner of Health. But we're honored to have Mary here at Rutgers now, and she is the Executive Director of Health Systems and Population Health Integration for Rutgers Health. Mary leads and supports multidisciplinary population health-related programs and research projects by developing partnerships with healthcare and public health partners at the state, local, and community level. In this role, she has led the development and the launch of several key programs, including the Population Health Fellowship Program and a podcast series called On the Pandemic, which engaged university experts and New Jersey health leaders in conversations regarding the challenges throughout the COVID pandemic. Again, as I mentioned, of course, Mary was with the Department of Health prior to as our Commissioner of Health, where she promoted population health initiatives during an extraordinary transformation in healthcare delivery here in New Jersey. I will go ahead and introduce all three right now rather than come back up. Dr. Noah Shimoni is also here at Rutgers University, and she joined the Family Medicine Department in 2012 as the Medical Director of Student Health Services. She is the alumna of New Jersey Medical School and completed her residency at Einstein Beth Israel Center. Dr. Shimoni completed a fellowship in family planning and an MPH in epidemiology at Columbia University. Her research interests in particular center on long-acting reversible contraception. And our last presenter for our keynote session is Dr. Joni Rivera, who is an assistant professor in the Department of Communications at Rutgers School of Communication and Information. She's originally from Puerto Rico, and her scholarship focuses on reducing health inequities and improving the well-being of Latinx and underserved communities through health communication initiatives. Some of you may remember Dr. Rivera presented at one of our symposiums a couple years back on miscommunication. Excellent work. Her work focuses especially on social media and health misinformation and how that can impact health decisions, specifically on cancer control, prevention, and on disaster relief. Dr. Rivera has her PhD in social and behavioral sciences from Johns Hopkins. Johns Hopkins. What is that, right? Come on. And her NPH in behavioral sciences and health education from Emory University. Will you be first? Is that correct? Okay, so let me come out of here. And I may need our tech assistant again because somehow the slides don't open as we put them into. Oh, we're good.
Look at you.
We are good. I'm a pro now. You're just going to push the green and the red to go back.
Okay, great. Excellent. Well, first, thank you so much for having us here today. Probably the most important thing in my bio is that I am a Rutgers grad. And I was telling Noah, this is a great room. I've had some of my best events here, so I'm really excited to be back. And I first just want to start out by thanking all of the people here who work at the State Health Department and local health departments. I don't think we thank our public servants enough for all of the work that they do, so I just want to give you a round of applause. And I know there's a lot of you in the room. So thank you for your most recent efforts in the last few years, especially around the COVID pandemic, and for your ongoing efforts today. Those of you who have worked closely with the department know you have some really great rock stars among you, but I just want to highlight a few that have worked with us on this project. Tina Tan and Barbara Montana, you've already heard from them. I have been in many interesting situations with the two of them over the years, and in particular around vaccine issues, and so I just want to thank them and recognize their leadership. And then also Jennifer Smith has really been a great partner on this project, and I want to highlight her. So my job here, assuming I can do this. Okay, let's try something else. It's not just you.
Okay, so you are.
Oh, okay.
Is that you?
Yes, that's us.
Okay, and it.
Now this will work.
Try again. Good.
All right, all right. So no conflicts to declare. That was easy. These are our learning objectives, and we really want to highlight the way that we've built this collaboration over the past few years, as well as talk a little bit about HPV, which hasn't gotten a lot of playtime so far today, so I'm excited that we're gonna fill that gap, because we see this as a really extraordinary opportunity. So talking about the history of this project, I just want to highlight how long it takes to build partnerships and trust. And I think that echoes in our relationships with the community, who we're asking sometimes to trust us in terms of taking these vaccines. But it also applies to those of us who are working on this together. The very first time we started this conversation was in the old H&A building, the Health and Ag building, in that conference room on the ground floor. This building no longer exists. And we, from Rutgers, met with the team at the Department of Health, the Vaccine Preventable Disease Program, to talk about potential ways that we could collaborate in this work. This was near the end of 2019. So two things sort of emerged from that conversation that I saw as potential opportunities that we both wanted to see. One was more connectivity with the registry, the NJIIS registry, and I think it was Steve Boers who mentioned, and one of the areas we really struggle with data is HPV, because it's not required for school entry, and so it's not required to be inputted into the system. And you know, there's a long and storied history with the HPV vaccine in terms of how it was rolled out and how we might improve uptake of that vaccine. And so I started thinking at that time, oh, there's a lot of opportunity here. And Noah in particular really wanted to get access to that registry because it really helps us at the school, university level to have accurate data for our students. Well, I'm not going to say there were a lot of benefits from the COVID pandemic, but one of them was that Rutgers really stood up a lot of vaccine efforts along with the state health department, and as a gift for that work, we were blessed with better access to the registry because of all of the investments that were made in that program. And so we had this opportunity, even though this idea had been behind the scenes before all of this, to really take more advantage of that. And over the course of time, we started to work with some of our other collaborators in sort of defining goals for what this project might look like. We all took a break for the pandemic in terms of, you know, refocusing our time and attention, but after that started to quell down, we had an opportunity to really spend time building this team of collaborators from Screen NJ because of the cancer prevention element of this particular vaccine. The state health department was with us, Rutgers Health, and student health services in particular, and we created these shared goals of better understanding what our vaccination data and rates were. We know there are gaps, we know it's not perfect, but what do we know? Better educating ourselves, our providers, and our students about the benefits of HPV and the new data around cancer prevention. And in fact, Meg Fisher actually did a program educating our providers here at Student Health early on, talking about that data. And then facilitating better access to vaccine for students, and then promoting all of this work in a community-engaged, sort of a collaborative leadership model, so that we could involve both students, providers, and all of our partners in some of these shared goals. The more recent work that we have done around our strategic planning has been around really better understanding the landscape. What is the data? What is the evidence? You know, we are a student population that's a little older than the CDC recommendations. So how do we think about approaching the college students in a way that's a little bit different? There's a lot of data and evidence and work around those pediatric recommendations, but this is sort of a different population we're approaching. How can we think about that? Who has been successful in doing this work in the past and looking at the evidence associated with that? Developing an infrastructure that supports this work. And so I was the first to volunteer, I think, to sort of like, you know, beat the drum on bringing us together, scheduling the meetings. Those little things just keep that relationship moving forward. And then really trying to think about how can we engage our target population students in this conversation. And that's where Dr. Rivera came in terms of a new partnership on health communications, specifically working with our student body as the creators of these messages, because that is who we want to speak to, and we want to know what is helpful and interesting to them. And then really launching a awareness and accessibility to the vaccine campaign this spring. So one of our work groups really started to go and do a literature search and better understand what does the college age population think about this in terms of barriers, concerns, and whatnot. And the data and the research showed us that there were concerns about side effects and safety. There was a gap in knowledge, not only in terms of their own vaccine status, but where to get it. And then a lack of provider recommendations and not knowing really who to listen to. And so I think one of the things that we have seen in the past is that providers are sometimes so focused on making sure that the required vaccines are in place and ready for school that they might take a step back when it comes to the HPV vaccine, because it requires a lot of other conversations sometimes. And they're really focused on those, I'll call them the primary vaccine requirements. And so there's an opportunity here to reinforce this particular conversation between providers, and student health services can be one of those messengers. In addition, what were the interventions that looked like they worked at this environment in the college population? And a lot of the research showed that it was both having that conversation, providing that awareness and education, but also strategically trying to make accessibility more relevant to that population, whether it's on campus or thinking about the different ways that students have access to vaccine. There's also the dynamic of sort of the parent-student relationship that has evolving during this period of time that we were trying to be cautious and thoughtful of. So the literature really spoke to us and told us, you know, the way that we need to work on this is to focus on education, to improve the accessibility, both from a sort of a mental standpoint and an accessibility in their own minds, making them aware of the need and the opportunity for vaccine, but also that they're still eligible. Because it's a pediatric recommendation, students that are a little bit older may not realize, wait, I can still get that vaccine and it's still really effective for me, and the evidence suggests that it is, so let's make sure they're aware. And a lot of students, I mean, I know my children don't know what they've been vaccinated for. They just know that they get them, right? And so once you're a little bit older and you're really taking more control over your own health, how do I know what I was vaccinated for? So we've actually tried to use the app that was launched by the health department to increase awareness for individuals so they know what their vaccine status is. And then they know that they have this opportunity to get it. And also to increase opportunities for vaccination on campus. We've talked a little bit about making them accessible when a student is at student health services for some other reason, but really understanding, and those of you who know Rutgers know that it's complicated here, right? And so we have many different campuses, we have many different student sort of groups, and how you can access vaccine differs based on which campus you are, which student health services facility you're going to, and really understanding our own process was quite important for us to be able to facilitate access. And then really focusing on that communication. Here in New Jersey, we looked at our own data. The best data we have through the state health department is really at an age group just before their college age, so we used that to inform our thinking. And what we found here is that a third of New Jersey's students are not fully protected, meaning some of them have gotten one vaccine, but maybe not all of the series. So one shot is great. And when we look at this data, this shows the one shot, right? So one shot is great, but there's opportunity not only to improve for that first vaccine, but also to complete the full series of vaccinations. And so for when you get this vaccine at a younger age, it's only 2 shots, but if you're starting later, you need to get 3. So one of the things that I'm going to do now is hand it over to Noah so that she can talk about how we start to look at our own data.
Thank you. So we really wanted to be data-driven. And so what that meant was getting the data out of our own system. And so what you're seeing here is kind of the beginning of our process. Every student who matriculates at Rutgers, at least in theory, but actually the majority of them do, submits immunization information. So they're required at baseline MMR, Hep B, meningitis, and they can, but they may not, also submit other immunization information. And so the question is, are we going to be able to have access to those, especially since they were not, or looking at HPV vaccination, you don't have a mandate. So we expected incomplete vaccination data, but wanted to know where we're starting off, so then we can do the delta, understand how we can improve, even if those data were not going to be perfect or complete. So we look in our EHR and we abstract all HPV data for all students. So in this first abstraction of the data, we extract for every single student, whether that student is 50 years old or 18 years old. We abstract for all students. And then we collect data on age, race, gender, international status, and the number of doses, so that we can assess whether a student is completely vaccinated or partially vaccinated, or we don't have any documentation. So really, when we're looking at this, the data that we're truly getting is, do we have vaccination data or do we not? We're making some inferences, but we don't know 100% whether they were vaccinated. We have an interface, since, as Mary spoke about, we have an interface with NJIIS. So that means when a student comes into our immunization database, there's a pull from NJIIS to grab the data. And so a student who is from a state that does not interface with our NJIIS, I learned today that we are at about 13 districts that exchange data with us with NJIIS. So if we have a student from New Mexico, for example, those data are not going to interface with our NJIIS. So this is something to advocate for, folks, with all states. And so we might not have those data unless a student submits those. And so that first abstraction of data was in 2024 in February. And what you can see here is that about 35% of students we had full vaccination data for. So they were considered fully vaccinated. This means that either the data came from NJIIS or those students, for whatever reason, looking at our forms, decided that yes, they are motivated enough to let us know that they were vaccinated against HPV, and one of our verifiers of immunizations actually verified that that information was correct, potentially because they had uploaded a PDF that had all their immunization records. So 35% fully vaccinated and 15% partially vaccinated. 50% of students did not have any documentation. So we took that just a little bit further and said, okay, let's look at the group up to the age of 26. And when you look at that, we had 61% for who had at least one dose documented within the record. And we actually thought this is really like an impressive place for us to start. But where do we go from here? Like, how do we drive any of our initiatives where do we go? And so what we wanted to do was start to break things by some sort of demographic. Who do we address? What messaging do we move forward with? And so what we did, and apologies in advance for this really busy slide, but I'll talk through it. The idea here was to take a look, first of all, at anyone who had at least one dose. And so we compared those who identified as female versus male, and we saw that 64% of those who identified as female were vaccinated or had documentation in our system, and 57 of those who identified as male had vaccination data of at least one vaccine in our system. And that was statistically significant, so it gave us an opportunity, okay, maybe we need to address the discrepancy, the disparity between vaccination, males and females. We went ahead and looked at international students versus who may not have had access to vaccine in their home country versus students who were considered US students. And we saw a pretty big gap and a really nice opportunity there, with 18% of international students having at least one dose versus 63%. So that was another opportunity. Students who identified as Latinx, 59% were vaccinated or had documentation, and 61 who were not. So there was a discrepancy there, not quite as substantial in some of the others, but still statistically significant and an opportunity. And last, we looked at full-time versus part-time students, and you see a discrepancy there. The confounder there is age. So when we actually look at age differences, full-time students tend to be a little bit younger, and so there's a higher likelihood that the vaccine was available for them, and therefore they got vaccinated. And so all of these pieces allowed us to go to the next step and to say, okay, let's choose one piece. So maybe one of the things that you can do next is pull together some focus groups. And Jody will talk about that, and the idea that let's try to figure out why there are these discrepancies, so then we can move forward with an initiative and messaging campaign that really works for us. And with that,
hi, everyone. And I do have to say, I am also a Rutgers alum. I did my undergrad here. So I'm really excited to talk a little bit more about the partnership that we've been able to establish that I've brought into the classroom. So if you recall, Mary was talking about the different goals that this particular initiative had, and she mentioned not only the education, but also the promoting community engagement. So they reached out to me. I had been working with Mary on some other things, and we started to have a conversation about some of the coursework that I teach. So I have an undergraduate course called Health Messages and Campaign Design that has some upper-level undergraduate students who are working and learning how to develop theory-driven, evidence-based health campaigns for different initiatives. And we decided that this was a perfect opportunity to really embed service learning into the classroom and also educate these students who, in a way, have become lay experts on this topic to be able to disseminate information to their peers about HPV vaccinations. So we actually, let me go to the next slide over here. So actually, this is the first group of students that presented, and you'll see some of their pitches in a little bit. So this is academic in me, the teacher in me. I want to give you a little bit of insights on what we do in the course, right? So we separate students into teams, and they're working in teams all semester. And the goal is that in the case of HPV vaccination, they are having an in-depth understanding of the HPV vaccine, how and why it's important in different types of cancer and genital wart prevention, and understanding more of this public health kind of perspective, right? What the problem is. Then we have a second phase of the course where they're learning about different behavior change theories so they understand the importance of conveying messages through evidence and theory-driven approaches. And here they're learning a little bit more about the behavior, right? Why aren't students at Rutgers or in general getting vaccinated? What are some of the barriers that exist? What works? How can we improve things? And because this is communication, we do a lot of audience analysis, right? It's very audience-centered. So I make sure that students are able to understand subpopulations and really hone in on how to message those audiences so that we can get them to get the vaccine. And the last part of the semester is actually them developing the campaign strategy. So this is where they get really excited and they get to be creative and use more theory to develop messages that work. Now, I want to highlight that in all of these phases of the course, we actually brought in guest speakers from this academic partnership. So we had people come in from the health department, Screen NJ, Partnership for Maternal and Child Health, and we also had faculty from Rutgers Health Student Services as well as Rutgers Communication in 3 different time points to really teach students how this is done in the real world, right? So students were provided with a lot of the data that Mary and Noah presented today, as well as focus group data, and I'll talk a little bit more about the focus groups in the next few slides. But they were encouraged to use all of that information, plus all of the research that they were doing, to really develop a plan targeting one of the groups that they wanted to work with. So for the focus groups, it was, we were really excited that we had the opportunity to hold 4 different focus groups to hone in a little bit more on some of those barriers and hindrances towards why some students may not have the full series of vaccines. And we used theory to develop these focus group questions. They were informed by different elements from the theory of planned behavior, health belief model, social cognitive theory, trans-theoretical model. A bunch of you know what all of these theories are. And what we did is that we actually held 4 groups, one with general student population, which actually ended up being all females, one with BIPOC students, another one with international students, and a 4th group with male students. And again, this was stemming from the quantitative data that Noah shared earlier. So we spoke to students for about an hour, and some of the common findings that we saw is that there was definitely a desire for learning a little bit more about the topic and about HPV vaccinations. We saw that accessibility was a huge motivator, and that was great. Noah's going to talk a little bit more about how the campaign actually rolled out or is rolling out. There were some concerns about side effects. They spoke about how they like to have maybe some more of that visual and in-person kind of engagement in addition to social media. There were definitely, there was a general uncertainty about how to get the vaccine, so that accessibility point was also really important. And then we have here some of the differences. So we saw with the female general student body that they believed males could carry but couldn't be infected by HPV. And they saw vaccine decisions as parents, right? That it wasn't their decision. And they did not vaccinate, or that parents didn't vaccinate because of the implications of sexuality and safe sex, et cetera. Within BIPOC students, we saw that there were conversations about distrust in information and in the medical infrastructure, as well as the role of religion in influencing potentially support of vaccinations. Within international student focus groups, we saw that there were some concerns over cultural stigmas and complexities of the US healthcare system and not really knowing how to navigate that. And lastly, with male students, there was a lot of lack of awareness of them actually being exposed to HPV and being carriers, and also different types of cancers that impact them. There was also some skepticism of cancer-focused messaging, so they kind of maybe wanted to hear a little bit more of other things related to right, like genital warts, et cetera, and also about the impact, curiosity about the impact that HPV actually has in males. So there was a lot of lack of knowledge and awareness here. So now I want to share the fun part, some of the student projects. And again, I didn't say this, so we had people come in, actually Noah, Mary, and a few others from the health department and the Partnership of Maternal and Child Health come in, talk about vaccines, talk about HPV. Then we had Rutgers Communication come in to talk about how to develop creative briefs, the way that we do it here at Rutgers, so that that could be embedded into the actual campaign that we are rolling out. And at the end, we had everyone come back to evaluate the students' presentations and select some of the really strong ones to inform elements of the campaign that we're rolling out. And I'm going to show some of those today. So this one I loved. I had a group of 4 females, Jillian, Elizabeth, Michelle, and Sophia, and they wanted to focus on messaging regarding prevention of cervical cancer through the vaccination for Black women on Rutgers, and they called the campaign Protect Her Future. These are just some highlights of each student group presented for like 20 minutes. So they were very much focused on their communication objectives. Here they realized that there was a dearth of information in this particular group, and they wanted to raise perceptions of threat of HPV and cervical cancer and provide resources for getting vaccinated. This group actually went above and beyond, and they surveyed Black female students here at Rutgers. They developed a survey, and they reached out to a bunch of organizations on campus, including Douglas Black Students Congress, Sisters with Values, and a lot of the different Black sororities on campus to get more insights. And one of the things that they saw was this importance of that future projection and embedding a little bit of that perception of threat as they identified through the health belief model. And they ended up coming up with this proposed ad, showing really strong visuals between someone who has their future right in front of them and then the consequences of potentially not getting vaccinated and losing that future because HPV had other plans. They really looked at different elements, cultural norms within this community. One of the students in the group was African American herself, and she really wanted to make sure that the statistics were present, the images were present, and that there was a call to action. We had a second group. They wanted to focus on HPV prevention for queer men at Rutgers, and their campaign was called Guard Your Health. They had 2 different objectives, again, informed by the health belief model. That was actually a very popular model for the students. And they wanted to increase perceived susceptibility of queer male students to HPV infection, as well as target perceived barriers about fears of vaccine safety, concerns about costs, and low awareness about where to get it. And I'm going to show you an example, their sample ad for this second objective here. It's not showing. Oh, that's a pity. Sorry, so the video isn't loading. But it was one of the students from the group who also identifies as queer, and he was preparing his coffee in the morning and then answering a lot of questions regarding these particular topics. Oh, yes, perfect. Beautiful, thank you. Yeah, and there's another video on the next one that probably won't show as well, so I'll definitely share them. Oh, and now let's see, there we go. So then the third group, and this group actually won the prize. I'll show their certificate in a second. They presented in the fall, and they focused on international students. Their campaign was Life Abroad Begins with Your Health. First-year students in particular, so they really went into a sub-demographic population, and they wanted to educate about genital warts and associated cancers. They also wanted to increase susceptibility of HPV as well as enhance their self-efficacy so they could actually go and get vaccinated on campus. And we'll share this video as well. And this one was really great. We had one of the students interviewing the international student. He's Chinese, and the video, not only was it funny, it had a lot of humor embedded into it, but they also had subtitles in both English and Chinese. And then lastly, we had a final group who wanted to focus on female freshman college students. As you can see, these are very niche groups. And this group in particular wanted to make sure to increase HPV vaccination by addressing lack of awareness and concerns about confidentiality. There were some female students who were talking about their fear of confidentiality, like if their parents find out that they're getting the vaccine, does that mean that they're gonna think that they're sexually active, et cetera, et cetera. So they actually developed two different objectives. One was a vaccinate and chill event where they had different pop-ups to talk about the vaccine, but also how important confidentiality is. They had goodie bags, etc. And then they had this video. Let's see if the video shows.
Honestly, I was nervous about getting the HPV vaccine. I didn't want my parents finding out and judging me. But then I found out it's solely confidential through Rutgers Health, and it felt so good taking control of my own health.
So this was an example of them having students talk about that confidentiality to kind of break some of those norms and stereotypes. So as I said, we had students evaluated, and they were able to include this in their CV and really like embed this experience into their academic development. And this was just one part of the rollout of the campaign. So I'll pass it back on to Noah.
So we had quite a campaign, and our campaign is very, very recent. So starting in March and in April, we partnered, as Mary mentioned, with quite a few folks, including our friends at Screen NJ. And you're seeing the van where students got vaxxed. So we started out with, there were different components to our campaign. And so the first component to the campaign was an educational campaign. And so this meant that we would create a website where students could have information. It would link to all the resources on all the campuses across Rutgers, whether that was in Camden, Newark, New Brunswick, or across Rutgers Health. We put postcards in all the bathrooms here in New Brunswick. We made postcards for folks in the other campuses as well. We put our messaging on all of the digital monitors that we had access to. We filmed a PSA, a public servants announcement, where Perry Halkidis, who is the dean of the School of Public Health, and I were interviewed by a student in Joni's class. And we got the message across that the van is coming to collaboratively vaccinate across campus. And what's the collaboration? The collaboration was with Student Health. So our folks at Student Health, we have our own inventory of HPV vaccine. We could book appointments in advance. And so the biggest billboard on earth came to New Brunswick in form of a van, and we had students come vax on the van, which was a really nice way both to vaccinate, although we all know that those numbers are kind of limited, but, I mean, how many vaccinations could you do in one day? But also the communication piece of having this billboard was phenomenal. The second piece was figuring out patient navigation. So when students might get vaccinated on campus, they might come to Student Health Services and they can get vaccinated here. But they might have an insurance that they actually can't use here. And there could be some challenges when it comes to that. And so we thought, how do we get students vaccinated? How do we get them the information? And how do we facilitate patient navigation? And this is another collaboration that we had with ScreenNJ. So we developed an algorithm that was actually pretty intense so that a student could call or use the GOMO app that ScreenNJ has and get patient navigated to a pharmacy, to an FQHC, to Student Health Services, to other areas, other places where they could get vaccinated. You know, I want to go back for a second because one of the things that we did, one of the pieces that we did was we took some of the data both from the initial data abstraction and the analysis, and also from the focus groups to inform our educational campaign. And so you can see it here. I don't know if this, let's see, it works, look at that. So when we developed this, our message was going to be, anyone can get HPV. Yes, even you. And what came out of the focus groups was that those who identified as men sometimes said, well, you know, we can carry it, it doesn't affect us, it doesn't do anything. Can we even get it? Well, yes, men too. Prevent warts, prevent cancers, men too. And so the hope was to actually, again, be data-driven, use the information that we got to then inform our messaging. This, as you're seeing here, was the very complicated algorithm, which has been used over the last few months for students to get vaccinated outside of campus when that was more convenient for them. Now, not only did this benefit Rutgers and students at Rutgers, but this also allowed us to develop an interface with ScreenNJ. So when students or anyone else comes and wants to be patient navigated through this GOMO app, they could be navigated whether they're a Rutgers student or not. I don't know there we go, and we are good. And then the van came. So we talked a little bit about the van, and this was very exciting for everyone. And we collected some more data. So this is very, very early, and we're looking at a little more than a year after the initial rollout. And when you look at 2024, these are the number of vaccinations that we had in our system, in our electronic health record. When you look at a little over a year later, we're starting to see an increase. So fully vaccinated students, we had 21,000 in our system, and now we have 22. Partially vaccinated students, we had about 9,000 in our system, and now we have almost 2,000 more. And so when you look at the proportions, yes, for the ones of you who are looking closely, the proportion going down from 43 to 40% is not nice, but our denominator changed by more than 5,000. Our denominator changed by more than 5,000. So I'm going to hold on for now to the win of these numbers increasing, and we're going to look further into to see exactly what worked. And that leads us to our next steps. What worked, what didn't work. We need to actually analyze, because we don't know what it is that moved the needle. Was it the fact that we did data cleanup and that we had our vaccination verifiers go into a ton more records, pull PDFs, even if a student did not necessarily submit an HPV vaccination date, and kind of pull that from their vaccination data? Did our vaccine advocacy make an impact? And did that result in vaccination at student health, especially since it was on everybody's minds? And so when we intook a patient, we also asked them about their HPV vaccination status. Did increased vaccination come from our van vaccinations or through patient navigation? And so all of this are pieces that, as we go to our next phase, we're going to analyze those pieces and figure out what we need to continue with to further this along. Our fall messaging campaign is right around the corner in collaboration with Rutgers Communications. And the group that folks are interested in working with right now is Greek Life. And so that's going to be a really interesting opportunity for us to see whether those social communities can lead to enhanced vaccination and better data. Certainly a big part that we're seeing is that pushing docket and pushing students' own knowledge about their vaccination status is really important to us. We did it a little bit in the spring, and I know that there was a huge aha moment with one student when we were vaccinating who was like, oh, should I get vaccinated? Should I not? Should I get vaccinated? And I'm like, why don't you just get the docket app and take a look? And 3 minutes later, okay, maybe it was 5, but about 5 minutes later, she knew that she was fully vaccinated with 2 doses before the age of 15. And the other part for us is we're going to share our story, and we're going to continue this moving along. And with that, I leave it to Mary.
So I know we, oh, yeah, great. So the only thing I was going to add to all of that is it's been such a joy to work together and really think about this differently. And when we first talked about some of the quantitative data, we saw that almost 80% of the population is likely to have at least had 1 shot. So that's when the hard work comes, right? For that 20%, how do you sort of slice and dice those different communities and speak to them individually? And we want to take your questions if there's time for that. Okay, so if you raise your hand, I think they're going to run around mics.
Ruth, can you stand up so that's...
Sure.
Hi. I'm Ruth Gubernick. Great campaign, great use of education and opportunity and partnership, really very exciting. Question, all the vaccinations that were given, have they gone to the NJIIS? I heard you say you have your own EMR. Are they flowing?
What a good question is what she was going to say as her microphone comes on.
This microphone is not working. This microphone is now working.
Yes.
Isn't that a great question? So our interface right now with NJIIS is unidirectional. And I know. You should have seen, for those in the back, you did not see the pained expression on Ruth's face. Yeah, and for very good reason. So I am very proud of an initiative that is ongoing at Rutgers. We had an EHR that was fragmented across the system. So Camden had an instance of an EHR, New Brunswick, Newark, and Rutgers Health. And over this last year, we have spearheaded going to one EHR with one immunization compliance manager with movement to hopefully a bidirectional interface when everyone is on the one system. And we're really, really excited that in the future, anytime that we vaccinate, because what we would do is we would make the effort for the small number, for an initiative like this, for COVID, we would develop like a separate CSV file that we would end up sending to NJIIS. But it's just not right. And we know that it's not right. And so I'm really happy to say that we're going in the direction where I think within a year or so, we will be ready to have a bidirectional interface with NJIIS.
Great,
Yeah.
that's great.
Thank
So
you.
a follow-up question is, for all the students that are getting their first dose or that you identified as having partial, what kind of reminder recall is happening to make sure that they get fully vaccinated? Is that
Yeah.
part of the?
We do have. So within our EHR, anyone who gets vaccinated within Student Health Services gets an automatic reminder, and that's part of our EHR. That's part of our electronic health record. When it came to anyone who was patient navigated with Screen NJ has a system where they send reminders. And so I've seen their entire spreadsheet of anyone who's been patient navigated with them, and I can see that they list in there when it's going to go. But it goes automatically both from their system and it's on their minds. So it is happening.
Great. And the last part of my question is, for those that you identify, once you have them, if they're missing other vaccinations or they're due for a Tdap or, is there an opportunity for them to get the rest of the vaccines that they may need as well?
Certainly at Student Health, this is a little bit more narrow, but we have initiatives throughout Student Health that, the same as at any pediatric practice, when they come in and when there is an intake, that we ask at least about, the standard vaccines, the more common vaccine. Thank you.
Hi. Thank you so much, by the way. This is the first time I've ever been to a conference, and that was such a wonderful presentation. As far as the initiative goes, was that something that's going to continue on here at Rutgers? And I'll just give all my questions in one shot, if that's okay. One is, was it just New Brunswick? Are you expanding out to the Newark campus? Two is, have you thought of expanding it from university to university? And three, was there projected numbers of how you expect that this would change your percentages going forward? As far as, I know you showed some statistical data on how you've improved and how the numbers you've already seen an impact. Was there a goal or some kind of expectation of what you continue to see moving forward with those numbers?
Thank you.
So I'll start with yes, but in limited capacity across all of the university. There are the 4 chancellor-led units, right? So Newark, New Brunswick, Camden, and then Rutgers Health has its own student body. And so this applies to all of them. Okay. Our work with our partner at the School of Communications and Information is a Rutgers New Brunswick-based class with a particular partner providing that class. We would love to increase partners in this and across the board. I think that one of our other next steps is to figure out who, in addition to who we've been partnering with, can we partner with, right? And we have been working with the Student Health Services on all the campuses, but we need more partners, right? This is a lot of work. But we think it's a great opportunity as well. This was our first shot at it, right? In terms of the data, I don't know if you want to add to this, but to me, the first thing is every year our student body changes.
So does the bus come back next year?
Wait, say that again?
Does the bus come back next year?
Oh.
Yes, yes. The bus is definitely coming back next year. Our initiative is continuing in the fall. It's going to be an iterative process. We're going to change it for the different populations. We don't need to capture every group at once. We just presented this at the American College Health Association meeting in New Orleans, and there was interest from multiple other campuses in collaborating with us. I mean, our focus is first New Jersey first. So yes, Rutgers throughout, yes, and then throughout New Jersey, we're collaborating with others and happy to continue. But it's going to be interesting to begin to pull data across states, and we have the opportunity to do that.
Thank you so much.
And
Awesome.
the point with our students changing every year is we get a new fresh crop every year, right? Like, so our data is going to be difficult to figure out because those students change each year. But I think we have a new opportunity each year as well, so.
That's awesome. Mary, we have a question from Zoom, actually.
okay.
And I know we'll be sharing your slides, so again, folks, we'll do that. But specifically, they asked if you would be willing to share your navigation algorithm. And we can certainly post that. I see you nodding, Noah. Yeah. Okay.
Yes, but know that it's very unique to our particular construct of a multi-campus, multi-school environment. So hopefully a different environment would be less complex.
The advantage of looking at our algorithm is that it's going to jog your mind to think about all the different places that students can get vaccinated, all the different insurances and other variables to consider. So ultimately, I'm sure that someone would have to create their own algorithm, but a lot of time was spent on it, so hopefully it could help somebody else.
It'll save time, sure. Excellent, thank you. We could do one last question in the audience if there is any, and if not, we'll keep moving.
Uh-oh.
Great presentation, by the way. You know, I've seen bits and pieces of what you guys have done, but seeing it all together is pretty impressive. Where does the resource of the bus come from? Is it, who owns it, and can other people tap into that resource?
Good question.
That is amazing. They're going to be so happy to hear you saying that.
So Screen NJ is supported by a grant from the State Health Department. In addition to other, supportive grants, it is available statewide. This was their first real big dig into HPV and vaccination. Primarily, I also was involved in kicking that program off. So initially, it was focused on GI cancers and lung cancer screening. So those were the two areas. It has subsequently, through budget language, been expanded to additional cancer, HPV being one of those, HPV-related cancers being one of those. And so we've really, again, when you talk about partnership, the shared wins. So they really needed to expand into HPV. We really needed a partner to help us get through this patient navigation and using the van. But you can certainly go to the Screen NJ website and reach out to their program. They go across the state, partnering with all sorts of different cancer screening initiatives, and they need partners. So please reach out to them. They're really excellent. All right, thank you very much.
It'll be easier if you just, we can definitely X out. And, oh, that's me, that's the one I want. So we can go to the next slide. Look at that, awesome, that was easy. All right. Thank all three of you very much, Mary O'Dowd, Noah Shimoni, and Dr. Rivera. That was excellent. We thank you so much for sharing that important initiative. Shockingly, we are actually sort of back on time. So let me give you the quick what's happening next. So we're going to be going into a quick break. Please visit the exhibitors again. Remember your passport in your brochure. You want to get that stamped, and then you'll drop it into the box that's up where you signed in for credits. A word about our breakout sessions. You all sort of pre-registered for these. If you don't remember where you were going, feel free to stop at the front sign-in sheet, and you can see we have the list up there. Couple just for directions. If you are attending the VFC program, this is the room. We're going to ask you all to move on up to the front when we start that session. The maternal and child health vaccination program is downstairs. You'll see the room. It's room 109. You can take an elevator, if you wish, down to G2, or you can take the steps all the way down. We have signs. We have people. You won't get lost. We have breadcrumbs. The NJIIS program is up on the 4th floor. You can take the elevator. You can take the stairs. We have signs. We have people. Again, you won't get lost. And in session D, is downstairs in room 108 on strengthening communications to enhance vaccine uptake. Again, you can take the elevator down or the stairs down, and you'll see signs along the way. So please be in your rooms at, what did we say, 10:30? Please be there by 10:30 so we could try to stay on track.